I'm Marge Ballot. I work in Kitsilano at Westforth Physiotherapy Clinic. I work with people with all sorts of musculoskeletal and orthopedic disorders, but I've also taken additional training in assessing and treating people with dizziness disorders. So that's why I've chosen the topic that I have tonight, which is called BPPV, which some of you may have heard of, but BPPV stands for Benign, Paroxysmal, Positional Vertigo. So by the end of my talk, you'll understand why it's called that and what can be done about it. That's the plan. And I'll do a little demo at the end as well to show how we assess it and how we manage it. So what I want you all to imagine, first of all, is that you've just woken up in the morning, you just get out of bed, and all of a sudden you're feeling off balance and you're feeling the room is spinning, and then it's gone. It's really quick. That's BPPV. And then you think, well, okay. It depends on your personality, but some people might just think, no big deal, just got up too quickly. So then you go to the shower, you start getting ready for work, and every time you look up, the same thing happens. You're feeling off balance, and the room is spinning. You're not falling over, you're not throwing up, but you might feel a little nauseous as well. And then you're starting to get concerned because, understandably, you're wondering what the heck's going on, right? So you phone your neighbor Mildred, because remember that she told you a similar story that she had this last year, and you phone her and she says, yeah, that sounds exactly like what I had, and I went to physiotherapy, and I went once, and I was all good. So, sounds appealing. So you give it a try. You come see me, you come on in, you give me your story, and that is the story of BPPV. So it's really sounding like that's what you have. The thing is, there are other causes of dizziness, so we need to make sure that it's not something else first. So I will look at your neck, make sure that's all good, and we will do some various eye movements and to make sure that it's not some sort of serious neurological disorder, something in the brain, but typically it's not. So let's assume we've done all that, and now we're thinking, okay, well, it probably is BPV, so BPPV. It is a little bit of a tongue twister. But this is the point where usually you start to explain to people what that is, because once we test it, we just treat it right there and then from that position. So you want to know what it is ahead of time. And to understand what it is, it helps to know how the balance system works. So in the base of our brain, in the brain stem, where you have breathing center and controls for blood pressure and all those sort of things, that's also your balance center. Your vestibular system, you might have heard of that. It controls where we are in space and our balance. And it takes in input from all the sensors in your feet and all your muscles and joints and skin from your eyes and from your inner ear. And then it figures out where you are in space. And then there's output from there as well, depending on what's needed. So if you need to, shift your weight so you don't fall, or you need to move your eyes so that you're moving to the same target that your head is, that kind of thing. So that all comes through your vestibular system. For BPPV, it's a problem of the inner ear, which is directly behind, well, there's your outer ear, there's your middle ear, and then there's your inner ear. So the inner ear is in your temporal bone. There's one on each side, and it's got a few parts to it, but we're just going to talk about the semicircular canals. So they are just that. They're rings that are hollow, and inside they have fluid and hair cells. And so when you move your head, then the fluid moves within those rings, and it stimulates the hair cells, it deflects them, and then the hair cells are connected to nerves that send a signal to the brain to tell you that you've moved, and that helps you know where you are in space. With BPPV, though, what happens is there's debris in those canals that's not supposed to be there. So they're not quite sure exactly where it comes from. They're thinking either it comes from somewhere else in the inner ear, or it's just cells from the lining of the semicircular canal that have sloughed off and are floating in there. So now what happens, you move, you get all the normal signals, you get the deflection of the hair cells, but then along comes that debris. There's a bit of a lag time, and it floats by, and it stimulates the hair cells, and then you get another signal that you've moved when you haven't. And that's where you get the dizziness and then that sense of imbalance. So fortunately, some creative people came up with a way to assess it and treat it, so that's what I'm going to show you guys. So your feet are over there, you're sitting up, come close to the edge, good. So I'm going to hold your head, you can hold my forearms.
Okay.
Like that, yeah, so not a death grip. And there we go.
Oh, I see.
Yeah, that's good. Okay, so we're just going to turn your head 45 degrees, you all right? Okay, on the count of 3, we're going to go down quickly. 1,
Okay.
2, let your head hang. Good. So, let's see. Oh, there's the nystagmus, and you're feeling dizzy.
A little bit.
And now it's gone away. Now, it could take as long as a minute for it to actually show up, so sometimes we have to hang out here for a minute. But assuming that it comes and it goes with that lag time and it's got the nystagmus, that's the confirmation for the BPPV, and then we can treat you right there. So just let me come around. Don't move. Come back onto the bed. Keep your head down. Come this way. There you go. And then we're just going to turn your head slowly the other way. So keep your eyes open. And again, I'm just going to wait for the dizziness to come and go and watch his eyes. So let's assume that it's come and gone. And then come onto your side. On this side. Yep, that's good. All the way over. Good. And then we're going to turn your head all the way towards the floor. Good. And again, just keep your eyes open. So just watch the eyes. And again, you're going to let me know if when the dizziness comes and goes. And then just sit. Yep.
Sit up.
Yep. There you go. That's good. And that's the Epley maneuver. Everybody in medicine likes to name something after themselves. So we have the Dix-Hallpike maneuver, followed by the the test, followed by the Epley maneuver, and then from there, you have some instructions when you go home as well. So don't want you doing any vigorous head movements for a day, and I don't want you sleeping on that right side for a week.
Okay.
And then once that week has passed, you can start doing that, and you can move normally. If you're feeling fine, you don't need to come back. If you're not, some people choose to come back for an appointment to get retested and redo the maneuver. Other people choose to do the Epley maneuver at home and test it themselves. So that's an option as well. The only thing I would say is that if you're going to do it at home and everybody's trying off the internet and following these things, just do it once. Because when it fails, usually it's because people are doing it repeatedly and they're just not letting the debris settle. So the idea is we're just moving the debris through the canal to an area where it's not causing symptoms, and then it should just resorb. And 80% of the time, one visit will actually take care of that. Sometimes it needs to be repeated. That maneuver needs to be repeated up to 3 times. And if you're elderly, unfortunately, it's more likely to recur. Right? If you're younger, it's less likely to recur.
So do we do the treatment right there, or do we do the test, like the analysis right there?
So what right now, we did both.
Oh, cool.
So you put them in the position, you watch for the dizziness to come and go, you look for the nystagmus that I've been passing on the iPad, I'll show you later. So if all that's happening, that's a positive Dix-Hallpike, and then from there we do the Epley maneuver, which is the series of rolling, and that's the treatment.
Free treatment.
And then you get to go. And then you might not have to come back. So if this happens to you guys now, hopefully you would know what to do.